Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Rattava Vyadhi, and after Pandu and Kamala, we will move to another disease which is very commonly seen and in which disease the Ratta plays an important role, and it is called as Visarpa. In a common language, it is described as a in modern way as a herpes zoster, where the rash is there and it increases along the same direction in the same line, and in anywhere in the body you can find this rash where there is a burning and some many times itching also. In clinical practice, we always know that it's a very common treatment that use शीतविरात्मक द्रव्य like chandan, like gairi, ushir to apply externally, and also internally the pitta shamak dravya, pitta ratta shamak like kandudha, shankhavasma, sariva, yashti madhu. So it's a very common treatment which we all use in our clinical practice. There are different types which are mentioned in the text about Agni Gadrama, Visarpa, etc. etc. To be frank, I have not seen in that much of intensity where what they have described in the text. Maybe in that era, the intensity of Visarpa is seen in at that level. Of course, it's my experience. If someone has experienced that various types of Visarpa described in the text, they can share their experience. I have to add one more thing, as because as I said, the treatment is common, Shitaviratma and Dravya, Lepa, etc. That by modern way, it is a viral infection and which goes along the nerve. As I said in the previous lectures about Kamala, that nothing wrong in taking help of the modern science or modern investigations and apply it in our way, in our fundamentals, so it can give benefit to the patient. So, Lakshan wise, you can say that Visarpa is Pitta Vyadhi having high burning, irritation, itching, and patient is uncomfortable. But if another reason behind that, along with Pitta Prakop, that it is a viral infection and it is a involvement of nerve also. So, can we think these two factors also, along with Pitta Shaman Chikitsa, to add the benefit to the patient? And hence, in my treatment of Visarpa, along with this Shita Viratmak Dravya, I also add the Dravya like Guruchi, which or Sudarshan, which are useful in the viral infections. Also, they are useful on the like Guruchi is useful on Rattava Srotas. We have described it already in previous lectures. Similarly, for the calming of the nerve or to reduce the irritation of the nerve, we can use dravya like Jatamansi, like Brahmi with Anupan Gruta, and so it will reduce the irritation of the nerve, and dravya like Guruchi, Sudarshan will be useful as they are used in the routine viral infections. So, along with the Pitta Shaman Chikitsa, which is Shita Viratmak externally as well as internally, I in person add this dravya like Guruchi, Sudarshan, Jatamansi, Brahmi to reduce the nervine irritation as well as to take the care of the viral infections. Another good dravya which I will particularly tell you about this Visarva Chikitsa, which I have used in many patients. We use generally Chandan, Gairi, Ushir, nothing wrong in that. But the Dravya like Jitasaya, which is available in market, is a very useful Dravya in the treatment of Visarpa. I have seen the patients which didn't get benefit from the Chandan or Ushir like Dravya, but the application, external application of Jitasaya has reduced their symptom and disease very predominantly in a very shorter period. Hence, the Dravya like Jitasaya, please keep in mind and you can use in your practice as I am sharing my experience, is also useful. It's a very useful Dravya, external application as well as internally. So, in the case of Visarpa, always remember as it is that Hetu sometimes we can't find, but many a times using cloth with synthetic material is seen as a Hetu, and hence when you are giving treatment you should rule out this Hetu which I have seen in my practice. So this is about the Visarpa. Again, I will request you if anyone has shown the intensity of Visarpa which has been described in the text, please share with all of us so it will enhance our knowledge clinically. In the case of Visarpa, as it is a Rattapadoshaja Vyadhi, logically Rattamokshan or application of Jalokha Ucharan at the site of the Visarpa should be useful, but to be frank, I have never used that treatment in my practice. So this is another point I will keep you in front of you, that if anyone has used Rattamokshan as it is a Rattapadoshaja Vyadhi by or any means by Jalokha Ucharan or routine Rattamokshan process, please share your experiences. By all this way, the Visarpa which is nothing new to say, as everyone has patients and the treatment remains, which is very commonly seen, Shitiviratmak, Pitta Shamak. So this is about the Visarpa. I will be happy to have your experiences of Visarpa, particularly the types of Visarpa which are mentioned in the text. Sometimes parallel to Visarpa, we always see the patients of Visphot, that is rash but not so much of burning and not so much of high intensity. In that case, again the treatment remains same, Pitta Shama, Ratta Shama, and if sometimes in the Visphot there is pus formation, then you can add a Gandhak Rasayan to prevent that Puyatpatti. So, Baki other treatment remains not much more different from the Visarpa. Just according to the Visport or pus formation, you can have this Gandhak Rasayan, Mahatittakvati like Dravya to avoid the Puyatpatti. So, this is for today's lecture. We will meet with another topic in the next week. Thank you very much.